John, Buffalo News, you're up.
Okay. Thank you. I was going to ask first, this might be for both David and Dan, but just can you kind of provide, some of the timing behind the decision when in Wyoming you guys started thinking about it, and at what point you reached out to UMMC?
Sure. Dan, I can kick this off, and then please, supplement anything that I've said. So, John, I just got to Wyoming last June as CEO. So I've been here just about 11 months. And I can tell you that the issue of obstetrics and the maternal health program here in Wyoming County has been an issue for many, many years. I think it was you, or maybe it was another reporter, asked me about the volumes in the county. They have been declining for decades. We did about 160 births last year, but they've been below 200 for 10 years and declining. About half of the volume of births in Wyoming County, about 40,000 people in total, don't come to us. They go to Batavia and UMMC, or they go west to the Buffalo market. So that's just been a reality here. But the hospital has been through significant turmoil in the last several years. There was a CEO here for a long time by the name of Dan Ireland. He retired in 2019. There was a new gentleman that came, Joe McTiernan, took over right before COVID. So they went through COVID. Now, unfortunately, Joe McTiernan passed away last year suddenly in January. And there were other events also, but the precipitating factor were financial losses, but also recruitment of providers. So that's one of the things that when I got here started to take a look at. And just to be very frank with everybody on the phone, we are a county-owned and operated entity, about $65 million in net revenue. And the OB program, maternal health, was losing almost $3 million a year just for maternal health. So it was obviously a financial concern for us. And the other, obviously, major and more prominent issue for us was the recruitment and retention of providers, obstetrical providers, and also pediatric providers for newborn nursery call, any OB program, and Dan can talk about this in more detail. You need to have 24/7 on-call support for an obstetrical program. We have one OB right now, one gentleman, and also one pediatrician. The pediatrician that we have announced his resignation 2 weeks ago, which precipitated our suspension of the program. That was the main factor, but we've been looking at this for many, many months. Dan?
Yep, thanks, David, for the backdrop. And as David indicated, we have had a presence in Wyoming County, in Warsaw, with a midwifery clinic where we were servicing patients there as well. And so when David, through his analysis, started to determine that there may need to be options at hand, and there have been times in the past where we have collaborated to cover as needed during a emergent situation and whatnot. So it made sense for us to have a conversation, and so as David indicated, when he received the notice about the pediatrician, we were able to build on those previous collaborations and discussions and react accordingly to be able to step in and bolster our resources to the community in Warsaw and Wyoming County. And so that's kind of what has led up to yesterday's announcement and today going forward.
John, second question?
No, that answered what I had, because they answered a few of my questions. So I'm all set. Thank you, guys.
Sure.
Thank you. Carla, Channel 13, Rochester.
Hi, I'm wondering what kind of impact this has on the staff on that floor, if they're going to be able to also go to Batavia, or what the plan is there.
I think I got your question. Your voice is a little bit garbled, but what's going to happen to the staff in the hospital, the OB staff, is that correct?
Yes.
So there's about a dozen or so individuals affected by this decision. No one will be laid off. There are no layoffs. They will be offered. We have plenty of positions in the hospital, vacant positions. So all of them will be offered alternative positions somewhere else in the hospital if they so choose. If they don't choose, that's up to them, obviously. But nobody will be laid off. In our OB clinic on the outpatient side, there's, I believe, 3 or 4 individuals. They also will not be laid off. There are plenty of positions within the health system. We employ about 600 individuals, so there's plenty of opportunities for these folks within the health system.
Second question.
And then my other question is, some parents have expressed concern about losing their pediatrician. Are they going to also be able to get services in Batavia, or what are those parents being recommended to do?
Yes, good question. So as soon as our pediatrician informed us of his decision to leave, per New York State guidelines, we are obligated to give a minimum of 30 days, and we actually did that sooner, so that we gave more notice to all of our existing patients and their parents, basically, of his departure. We have other family medicine providers within our network in Wyoming County, and we also referenced other pediatricians in the area or Batavia where these folks could seek care.
And to build on it, our pediatric offices in Batavia do have the capacity to take anyone who wants to specifically see a pediatrician. But as David said, when in our discussions, we wanted to give everyone as much of an opportunity as possible, but the doors are open if they so choose to head that way.
Thank you. WKBW Buffalo? Do you have a reporter on? Okay. Channel 10, Rochester?
Hello. Yes, my question pertains to the fact that this ongoing issue isn't necessarily limited just to Wyoming County. It's affecting counties across the state. And I'm wondering if, in order to provide continuous care, whether UMMC intends to potentially take in more patients from other counties in the future, if that's something that's being weighed as an option at the moment.
I think it's a very important question, and thank you for that. I think it's important to understand that, and I think David would agree with me from his perspective as well. As hospitals keep an eye on what's going on in the needs of the communities around them, and as the current healthcare, and I'm calling it a crisis that we are seeing post-COVID at all hospitals across the state, are impacting the decisions about operations and the availability of resources, people and resources to be able to conduct that we have to continue to collaborate and be willing to help each other out, support each other. So the short answer is, if there were other patients from outside of any of the surrounding counties who needed services, we are there to provide those services, and we want to do it well and with high quality of care. And I think that has to be the nature of the business going forward. Additionally, we have to do it with innovation in mind. We have to think of creative and innovative ways to make contacts with those patients and make sure they know services can be accessed as close to home as possible.
Second question or no?
Thank you. That's my only question for now.
Okay. Matt, Batavia?
Yeah, we've had a couple moms calling in. They're interested or they're wondering, is it known what department or what Dr. Balayas' status would be at this point? Like whether he go to a different department in the hospital, or has it been determined yet, or is that still being determined? Or
Yes, Matt, I can take that one. We're not in a position to discuss kind of personnel issues. Dr. Balayas is under contract with the hospital, so at this point, I'm not at liberty to discuss that.
oh, that's no problem. And I'm good.
All right. Thanks, Matt. WGRZ? Buffalo? Channel 10? Okay, I know that they were hopping on, they were actually down there, so we'll see if the recording is good for them. Alicia, I know you had no questions, News 4? Okay. I guess we're back to the beginning. If I'm missing anyone, anybody have any additional questions they'd like to ask?
I do have one more question, if that's okay. I'm curious, does this also impact gynecological services for women?
Well, let me take that one, Dan, and please join in. So our current provider is an obstetrician gynecologist, so he provides both. So I think Matt's question earlier about that provider, if that individual stays with us, and we hope that he does, our intent would be to continue providing gynecological services to the service area, Wyoming County service area. If he chooses not to, which is obviously his choice, we would be looking to recruit for GYN support for Wyoming County. That would be our plan.
And I would just add on to that is that in the adjustment of the resources for our Warsaw clinic, we will be a full service clinic in Warsaw. So, ladies who transfer to us for their OB services will also be able to access their GYN services as well. So we're going to make sure that people get care as close to home as possible, and won't have to split around. To get care. So again, as you can imagine through this, it is a collaborative walk with David and his team. We want to make sure that we are supporting as best we can, but making sure that care is where it needs to be.
And Dan, if I could just add on to that, in our joint press release that we sent out yesterday, there was a notation in there, which I think is it's important to emphasize. The partnership between Wyoming County Hospital and UMMC is very strong. And UMMC and Dan and his team have committed to take their existing clinic, which is about a mile from the hospital campus. And it's our intent to combine that clinic into our main hospital campus. So patients coming here can kind of have seamless care for pre and postnatal services, testing, diagnostics, those kind of things. They would drive to Batavia, which I just remind everybody is 25 minutes from Warsaw. It's not very far to deliver. UMMC would take obviously higher risk cases and handle those within their system, but for routine deliveries and care, that those patients in Wyoming County, those residents, can stay here in Warsaw for their pre and post care.
And I'll just wrap that up with, and thanks for pointing that out, David. I would wrap that up to say that UMMC is supported through our health system, Rochester Regional Health, with physicians who handle high-risk pregnancies, including options for telemedicine and site visits in the Batavia offices. So currently, some higher risk patients who may even now travel out of the community for specialty visits may only need to be traveling to Batavia on occasion, or may even be able to get telehealth visits where it's appropriate and warranted. So again, I'll go back to the same theme over and over. It's providing the highest level of care appropriately as close to home as possible and minimizing the impact on the community so we can offer the best care.
Any other questions?
Yeah, I'd ask one more. David obviously addressed kind of the declining, delivery volume at his hospital. So I guess, Dan, at UMMC, what are the trends been in terms of your volume over the years?
They've been relatively stable, John. They've been floating in and around that 500 range, in year over year, and hard to gauge in the last couple of years because with COVID and people still had babies with COVID. It was there's been some fluctuations in the industry, related to that. But I would say over the last 7 to 8 years, we've seen a steady fluctuation around that 500 mark. Last year ending up around 457, but in years past been a little bit over 500. So it's no real trends necessarily for us going in any particular direction. I would call it just normal variability that you would experience with this type of volume. And I would tell you most community hospital OB units tend to run between 400 and 800, 900 patients for hospital beds our size. So we're right in that swing of where most stable community programs should be living, given our bed size and community aspects.
Hey, John, can I just add one thing?
Mm-hmm. Yep.
So there's a metric in the industry in hospitals, and I've been in rural hospitals for most of my 31 years in the industry. Once a hospital drops below about 200 births, that's a red flag. And the reason for that is mainly quality of care. To maintain competency in any clinical specialty, you have to do whatever you're doing, whether it's surgery or delivering babies or whatever else. It's repetition. And we've been below that number, that kind of red line, for a while. What that meant for us is we had nurses on our floor who would sit sometimes for 2 and 3 and 4 days with nothing to do. And it's very tough to maintain your competencies. And I know Dan's got a background in nursing and he can speak to this in more detail, but that's a tough situation, not only just for Wyoming County and our hospital here, but across the country in rural areas that have declining birth numbers. UMMC is a much bigger operation, obviously, and they have much more resources. But typically another benchmark to have a safe obstetrical program, you need at least 3 full-time OBGYNs just to handle the 24/7, 365 call. Those are just some kind of benchmarks. In any rural area that's lacking in any of those or has some red lines or red flags, that's something that entity, that organization should be looking at.
Yeah, thank you for the context.
Well, thank you all. If there are no more questions, I don't know, David or Dan, if you want to give any final thoughts before we go, or I think you both covered everything quite well, but if you have any final thoughts before we jump off.
The only other thing, Christina, that I would add is I was born in Buffalo and started my career at Buffalo General. Then I traveled around the country and I've been from Florida to out west, California, Seattle, and a lot of hospitals in between. Rural healthcare today, I think, as Dan has noted, is in crisis. There are literally hundreds and hundreds of hospitals across the country and many in New York State that are going through the same issue with their obstetrical programs. So this is nothing, it's not unique to Wyoming County. This is really a nationwide crisis. And I think this is just what we're doing in Wyoming County. I think in the board, we talked about this with the county legislature and so forth, is strategically important for us to partner with organizations like DAN's and UMMC going forward, so that we have a viable healthcare entity here in Wyoming County 20 and 50 years from now.
I would echo that as well. I think I was going to, my closing comment would just be today's healthcare environment and the healthcare of tomorrow is going to really rely on collaborative relationships, partnering with each other, and really right-sizing healthcare to where it needs to be from a quality perspective, in addition to the operational perspective. So, I believe healthcare is going to continue to see transformative changes in the coming years, and I'm looking forward to our continued partnership with David and his team at Wyoming County, so that together we can all serve the community to the very best of our abilities.